question for you. Do you have an idea of a percentage of people who don't get better, or do you see most improve? And what do you think happens when people don't get better?
It's frustrating. I mean, it's a good average in my practice. 90% of people, a significant number, easily see improvement. You know, how many completely improve? You know, it's probably about a good 70 to 80% that are improved. They may have some symptoms that they, don't quite, remember, but they're there. But the vast majority of people get significant improvement that they're happy with their implants out. There are definitely people that don't get better or very, very slow responders. And again, like we talked earlier, I am not an expert at all on detoxification process or the immune system. It is a very, very complicated thing to understand. And, immunology is a medical profession. I don't think started until the 1970s or 80s. It's new. So I don't make recommendations because I don't know enough about it. As a surgeon, I tell them the first part of that detoxification process is you get the silicone out of you. You get that silicone implant out of you. Again, another reason to take the capsule out, because if there's anything associated with it, silicone or whatever, you've done your best mechanically to start the detoxification process.
Yeah.
For most of my patients, that alone is enough that their immune system can start to reset and they start to see improvement. And I mean, it always takes time, but for most people it is. But yeah, probably, I bet you a good 10% of people don't. And that's where it's hard, because it's hard to find, somebody that you can trust, somebody that's going to help steer you in the right direction these are the things and steps that we're going to do. And it's going to take time to start getting you better.
Yeah. And specifically for this population,
it is.
So,
And that's
multifactorial.
The hard part of social media. I mean, everybody sees the people that get their implants out. Here's a picture of their face and eyes. Here I am in the recovery room, and there's a difference. And they see that, instant recovery and everything gets better. And you always hope for that, but everybody heals differently.
Yeah, everyone's different. And I think we all have different stressors in our lives. We have the breast implants in common, but there might be other things going on. And I think it's important that people understand that you can't expect to go into surgery and come out feeling 100%, right? There may be other things going on that need to be worked through, and that's okay. You can get there.